I may or may not have enjoyed a beverage or two of the alcoholic persuasion. And then the next morning I woke up and I would have endured a headache with almost that kind of ringing sensation.
Sure.
That probably wasn't tinnitus, right? Or was that just symptomatic of the headache itself?
Probably not. Now, it could have been had you been consuming those alcoholic beverages, like at a concert or in a loud bar.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Jordan Strong.
On today's episode, we're going to discuss the dynamic between tinnitus and headaches, written by Dr. Nicole Koval of Elite Hearing of Colorado Springs. Dr. Jordan is going to discuss how the two ailments can sometimes work hand in hand. But let me ask you a question first.
Sure.
Are you a migraine person?
I'm not.
I'm not a migraine person either. Mm-mm. I've never, to my knowledge, had a migraine. Like, I'm not really even a headache person. Mm-hmm. Is it because you drink a lot of water?
No, I think I'm just lucky.
Yeah. I feel like you're either a migraine person and like you know you're a migraine person, or you're like completely unfamiliar with that experience. So that's interesting because I'm not either, and I don't think I do anything unique as it relates to drinking water, though I do drink a lot of water.
I think I can maybe think of one instance where I think maybe that was a migraine.
Got it.
It was brutal.
Was it?
Yeah.
I mean, I know the people who like lights off, cold towel, like no sensation whatsoever for hours on end. I was just curious if you're a migraine person.
No.
Okay. Well, since we're both perfect, why don't you tell us about a little bit about tinnitus and its association with headaches? Yeah.
So tinnitus, of course, is kind of the presence of a sound within our head when there's no presence of that sound in our environment.
Got it.
And then, of course, a headache or a migraine. I think most of us have probably experienced a headache. And of course, a migraine is something that's just more severe than that. And they can kind of coincide together.
Sure.
And there are definitely cases where I think it can kind of be back and forth. I feel like you can either be the person where your migraine triggers your tinnitus or your tinnitus triggers your migraine.
Got it. And there's no real rhyme or reason to that, right?
Exactly.
It's based on the individual.
Yeah.
So if there was a time when I was younger, and I may or may not have enjoyed a beverage or two of the alcoholic persuasion, and then the next morning I woke up and I would have endured a headache with almost that kind of ringing sensation.
Sure.
That probably wasn't tinnitus, right? Or was that just symptomatic of the headache itself?
Probably not. Now, it could have been had you been consuming those alcoholic beverages, like at a concert or in a loud bar or something like that, then definitely you could wake up and have that kind of temporary threshold shift, that ringing is there, buzzing.
Got it.
And then that can coincide with the headache from the alcoholic beverages.
Hypothetically, if I ever did anything like that.
Sure.
Which,
hypothetically.
Who's to say?
Yeah.
So when somebody comes into your practice and they say, Dr. Jordan, I not only experience tinnitus, but then I experience a headache after the fact, or if I experience headache, that triggers tinnitus. What is your course of action with them? Sure.
Yeah. So it's going to decide which one's coming first.
Yeah. And how do you do that? Like, do you have to actually wait for something to trigger within the patient? Do you try to get...
Well, I mean, just asking them, whenever this happens, do you feel like you hear your tinnitus first? Or do you typically, you notice the migraines coming on or the headaches coming on, and then you notice the ringing later?
Sure.
And for the most part, they'll pinpoint it. They know. They're kind of hyper aware of all of these things.
They're like, well, I've had this for 15 years, so I know exactly how it happens.
Exactly.
Okay, got it.
And then from there, if it's the tinnitus, we're going to treat the tinnitus if that's what's causing it first.
Got it.
Which can be really annoying, and that can trigger stress and tension and all of those things. And if that's what's happening, then definitely we'll treat the tinnitus first.
Got it.
And if it's the headaches or the migraines, then we're probably going to refer you to somebody to get that checked out, and then we can treat the tinnitus secondary.
Got it. Have you ever experienced something that was pretty severe on either front where, hey, I get headaches, which aren't the worst thing in the world, but then my tinnitus just like flares up? And if they did, if that was the cadence, right, it was the headache first and then the tinnitus, would you try to treat the tinnitus, or would you say, let me refer you to what doctors would take care of tinnitus or for migraines?
For the migraines, maybe their primary care physician, but typically I would probably refer on to neurology.
Got it.
And start there. Okay. And then get that checked out, get it treated, and then we'll talk about the tinnitus after that's kind of been looked at, checked out, make sure everything's good there.
Got it. Have you ever had somebody come in who says, I have headaches and it leads to tinnitus, but then you've diagnosed it and it's like, actually, it's not tinnitus? Have you ever seen something like that? It's mystery tinnitus. It's fictitious tinnitus.
Not that I know of. No.
I was just curious if somebody just
I'm
assumed.
young in my career, so.
True. Dr. Jordan is only 22 years old. She's a Doogie Howser of audiology. But so typically if somebody dialed it in, they're like, no, it is tinnitus and you can confirm it's tinnitus.
Yeah.
How do you actually test for tinnitus?
So it's pretty subjective as of now. Now there's actually a lot of research that's kind of on the forefront that's coming out pretty quickly that we may have some other objective things that we may be able to test tinnitus in the near future. And that's really exciting. But as of right now, it's a pretty subjective testing.
Is there like a baseline where you're like, hey, if you fall within this, I don't even know what to say, quadrant, like you probably have tinnitus?
Yeah, it's more out of like questionnaires that we use where we can verify the tinnitus or the severity of the tinnitus in those different types of questions and different questionnaires that we can use.
Got it.
And that way we can kind of categorize it.
And so if you're diagnosing it, what is like a typical, like obviously treatment is sometimes there's masking, right? Which, nailed it. And then there's hearing aids that can also like kind of counterbalance the frequency of the tinnitus too. But what's just a great way for somebody who says, I don't know that I care enough to like invest wholly in that type of technology to prevent headaches, migraines, tinnitus from occurring? Yeah.
So for those types of people, I would say definitely don't be in silence. I know that sounds a little bit simplified.
I talked about that not too long ago on a podcast, which is dead silence, a quiet room just leaves you and your tinnitus alone to function. And that's not great.
Spot on. Yeah. So definitely having some type of background noise, sound machines. I mean, there's a million apps on our phones now. You can go to YouTube, type in any of those things, and it's going to pop up different sounds.
Sure.
You'll find what's most relaxing to you. So definitely doing that. Even a fan noise, having the TV on in the background, a radio, something like that to give your brain something else to focus on is definitely key.
Got it.
The other thing is definitely reducing your stress.
Okay.
Stress.
That feels much easier said than done, Dr. Jordan. Just don't be as stressed, guys.
I know. Just don't do that.
Just don't stress.
I should take my own advice. So kind of the three things that they found in a lot of research, it's kind of the recipe for disaster for tinnitus are things like sleep, anxiety, depression.
Got it.
Those are kind of the caveat to bothersome tinnitus, which can lead to those headaches and migraines.
For sure.
So definitely if we can kind of tackle those three things, tackling the silence part, adding in some background noise, and then just reducing your overall stress. Go get a massage, just have some quiet time to yourself, play a podcast, listen to something different.
Maybe this one.
Maybe this one.
I love it. Bring it back. That's synergistic marketing right now. Listen to a podcast. And if you're going to listen to a podcast, maybe it's this podcast. Yeah. When you go on your walk to increase your endorphins.
That's right.
Put in some earbuds, download the Ask an Audiologist podcast.
That's right.
Then you download this exact episode and you're going to be bettering yourself both physically and mentally.
Perfect.
That's why they pay you the big bucks, Dr. Jordan.
That's why they do it. Yeah.
That's why we had to back up the Brinks truck for her to get her in the seat. So from tinnitus to hearing loss and everything else audiology related, navigate your way to askanaudiologist.com. And for all your hearing healthcare needs, all you need to do is just listen to this podcast.
That's right.
Dr. Jordan, thank you so much.
Absolutely.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
We don't expect a 4-year-old to have perfect R's,
right.
Or S's, for example, especially like my children who don't have any teeth right now. That's not a West Virginia
thing, by the way. That's just an age thing.
Yeah. That's a 6-year-old thing.